And welcome back to the program, Your Local Government. Our guest is Craig Stedman, DA of Lancaster County. In the second segment, we were talking about heroin, and you're saying it's worse than it's ever been. It's an epidemic. And clearly there's no easy solutions. As you said, we need to do some prevention and education. And highlight that just a little bit more from your perspective, what we need to be doing.
Well, we're the third worst in heroin abuse in the entire country. So Pennsylvania, in Lancaster County is not immune to this. We need to do something because that's not a number that we want to have. So you've got to combine enforcement with education and treatment. And what I mean by that is, it used to be, I think 20 years ago, people would say, well, treatment. They're not going to accept treatment unless they, not going to respond to it unless they want to get treatment. And that was always the way everyone was talking about things. If they don't want it, they're not going to be cured. Mm-hmm. What they're finding out now is you can actually sort of threaten / force treatment. So in other words, you can say, look, you can go to state prison for 3 years, or you can go to inpatient rehab for 9 months, or prison for 6 months, and then inpatient rehab for 9 months, and then outpatient, and ongoing. And people can recover from that, and they can be rehabilitated. I don't want to lock these people up for these things, but some of them we just have to. One, because it's the only thing that's going to get through to them, to get them into treatment and to change their lives around. And two, if they're major dealers, if we're locking them up even for some period of time, they're not selling to somebody else's child who, I've had numerous discussions with families, all walks of life, all over the county, who have lost their loved ones to overdose, and I'm sick of it. I don't want to do it anymore. I don't want to meet with any more of them, and sometimes we just have to lock some of these people up. Now, we're not going to arrest our way out of the heroin problem. We're not going to jail our way out of it, but it has to be part of the conversation. And that sort of brings us back to some of the national things that we're talking about. And when the signal's coming from the top in our country saying, oh, what's the big deal? It's just marijuana, it's just a little drugs. You're sort of saying, you're sending the message that this is no big deal, this is no problem. Then younger people start thinking, well, why shouldn't I use this? The president says it's okay to smoke marijuana. And then, it's not, that's a gateway drug into these other things like heroin. So. Mm-hmm. We have to be more mindful that there's more heroin out there than ever before. It's cheaper than it was before, and that's why you see people turning from prescription medication addictions to heroin, because it's actually cheaper and easier to get heroin. But people are dying from it because it's so deadly, and then they're mixing it with things like fentanyl and other controlled substances. I'm not sure I could tell you exactly what the answer is, but you could start out by having these like town hall meetings like Lidditz did, and get a broader audience, that people that understand that this isn't just some inner city problem, that it's all over the county and it's everywhere, and hopefully, too many more people won't have to die for this. But we also need to listen to the people that have been addicted to this, and they're telling us, I've had guys walk up to me and say, you sent me to jail for a number of years, but I needed all that time, otherwise I would have come out and sold again, or I would have used again. Mm-hmm. To get their head straight on it. And so you have to find the right combination. That's a challenge that I have to do as a prosecutor. How much of this is punishment? How much is this rehabilitation? What's the right sentence? Of course, we have to do it, in the framework of the guidelines that we have, but, try to individualize the sentence, because you can't just say everyone should be treated the same in every single case. But it's going to take a community response, because heroin abuse, drugs, they're not just ruining lives or taking lives, but it's not just that individual, it's the family members that are trying to save them. I had an employer come up to me last week, said she had to let go someone who used to be a good employee because he was a heroin addict and he couldn't function anymore. Mm-hmm. And he'd been a long-time employee, and she didn't know what else to do. So you're hurting every aspect of the community with the drug problem, and it's worse than I've ever seen. When I started in the early 90s, you could count on one hand the number of heroin cases that we had. Now it's all there. It's just daily. We're having stuff daily, and the amount that we're intercepting. And now you have synthetic drugs as well, things like K2 spice, synthetic marijuana, that the medical community is telling me, they're getting 3, 4, 5 coming in per shift, overdoses on this, and these people are like chewing on the bedposts. They think they're dragons. They're out of their minds. And it costs thousands of dollars for them to get treated, and that's all taxpayer money. So it's something we have to really confront and fight on every kind of level.
Mm-hmm. Now, we have this stereotype of the heroin dealer, but you brought another spin to this, is that sometimes people have a legitimate injury, they're starting on a painkiller, they get addicted to it, They can't get those anymore. What percentage of them are in that category? Do you have a guesstimate?
I don't know whether I could give you an exact percentage, but it's a large percentage, and that you've seen a lot of these people that what we saw was, and I'm not attacking the doctors in any way, but they were overprescribing prescription pain medications. We didn't have these kind of drugs in the 70s and 80s to give out. So when you've got a patient coming in saying, I have pain, I have pain, I have pain, well, you can't really quantify that. So they were handing out these things more than they should have been. And they've cut back since then. But what you saw and what you were seeing is people were getting hooked on these painkillers, so Oxycontin, what have you. And then the doctor's saying, no, 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 I'm not going to do it anymore. So now they're saying, okay, what am I going to do? I need some kind of fix. And a lot of those people are unfortunately turning to heroin because it's available and because it's cheaper. Mm-hmm. So it wasn't an issue before. And the other thing is there's just more heroin out there, more opium and heroin than there was before. So it's those two combinations that are driving the heroin addiction, the heroin problem. Of course, it's so powerful. Once these people get sucked in there, it's very difficult to quit. Mm-hmm. And that's why I say incarceration and arrest matter, because they're not going to wake up in the morning, heroin addict isn't going to say, you know what, I'm just going to stop using heroin today. That's not even in their brain waves, it's not even their makeup anymore. All they're thinking about is their next fix. How can I get it and how can I get away with it? And again, it's a different mindset that we have to understand. They're not thinking rationally anymore, other than to the point of how do I get what I need to get. And I think you and I were talking at one of the breaks about how they're seeing that there are people that are more genetically predisposed to to addictions to some of these drugs than others. And so it's not just sort of like sitting down at the table and you and I saying, I want you to stop using heroin. Here's all the bad things about heroin. I want you to stop. It isn't going to matter. It's going to go one ear out the other. How can I get what I need to get? So we need to look at it as a medical problem as much as an enforcement problem. Because it's a health risk, it's a whole public safety risk, and it's going to take all elements from all over society to come together, educators and to stop it.
Yes. Well, best of luck with trying to bring some solutions to that. You got a lot on your plate, but I can't imagine anybody more qualified to handle than you. So thank you for your service. We appreciate it. That's going to do it for this program. Join us again next time to learn about your local government.